Hello, my name's Michelle Brogan. I'm a Service Development Manager and work for the Scottish Centre for Telehealth and Telecare. Part of that role is involved working in a European project called United for Health as the Programme Manager. So what I'd like to do today is to really share an update really on the project and take you through some of the key progress that we've made over the last 2 years. United for Health is a 3-year European funded programme. It's essentially looking at scale deployment, and what that really means is looking at how we can deliver health and telecare services to a larger group of patients. This programme specifically focuses on home and mobile health monitoring. It's a large consortium of partners that we're involved in with Europe, and you'll see on the slide really the range of partners. We're one of 14 regions, and we're examining and deploying home health monitoring to 4 long-term conditions: COPD, congestive heart failure, hypertension and diabetes. We're very proud in Scotland also to be the lead for the programme, and this really involves us having an overarching coordinating role across the whole consortium, and with that comes, a lot of political significance as well, so we're proud to be in that role. But what does United for Health really mean for Scotland? Well, this is our first large-scale deployment project. It isn't a randomised controlled trial, but really more an observational study looking at the impact and effects of home health monitoring with a large group of patients. So for us in Scotland, we had an ambitious target of deploying telehealth home health monitoring to over 7,000 people over this 3-year period. But for us in Scotland, it really wasn't about developing from scratch. We've had the opportunity to work with home health monitoring for over 10 years in Scotland, but never really anything on this scale. And fundamental to this change is the redesign that needs to happen locally. It's less about the technology, but really about how we take that forward. And as you'll see in the slide presented here, fundamentally it really is about improving the care and well-being of the people and population of Scotland, and also the access to services. So we had a number of partners that worked collaboratively with us in terms of United for Health. You'll see them here on the slide. Our main contributors in terms of the deployment and recruitment activity for the project fell into our health board regions, which you can see here. So they're all really located in the west of Scotland. So we have Ayrshire and Arran, Lanarkshire and Greater Glasgow and Clyde, represented by Renfrewshire and East Renfrewshire. We also had the opportunity to work with some technical services and suppliers through the Sky Diabetes team, and also we also were able to work with other industry suppliers. So a real collaboration, I think, we really had taking forward. So what are the benefits of home health monitoring, and why do we want to apply this at scale in Scotland? So we know that there are enormous benefits to be gained from this. We know this from a growing body of evidence and research. But what we're less sure about is how to do this well and how to do it at scale. So this is what United for Health is about. So it's about looking at these 3 conditions in Scotland you'll see on the slide. It's about deploying this at large scale and really evaluating the clinical and cost effectiveness of these solutions. And basically, what do clinicians think of it? What do our patients tell us about it? And what impact has it made on service delivery? So we'll move on now to tell you a little bit about some of the technology solutions that we introduced, very briefly, just to give you a flavour of what we did. So for COPD and for congestive heart failure, we really used a range of technologies, from very simple SMS-based texting services to much more what might be classed more as high-tech technologies. So we had a range, and each of the local partners were individually responsible for procuring that technology. We worked with predominantly respiratory teams and heart failure teams within these localities to undertake and introduce the technology into their services, and also they participated by monitoring and working with patients. So in terms of the diabetes solution, we took a different approach. We developed a new solution for Scotland, a Once for Scotland solution, which really was rolled out at scale across 3 of the deployment site areas. So essentially what we aimed to do was to bring together two national platforms in Scotland, one called Sky Diabetes, which is a clinical portal, together with a patient self-management portal called My Diabetes My Way. By bringing those two solutions together, we introduced a digitalised solution for blood glucose monitoring. A very easy way for patients to digitally upload their glucose meter readings into My Diabetes Way and have access to an increasing amount of information so they can manage more effectively their own health. We're really excited about this solution because across all of the European partners, we were the first region to really take this forward. So I think we're very proud of having that innovation and taking that forward. Okay, so what have we achieved? So currently now, with 2 months to go within the project, we have managed to increase the accessibility of people to home health monitoring. We have over nearly 6,000 people accessing these services. Over half of that are new people that are registered to the My Diabetes My Way platform. We also have 9 brand new service startups for home health monitoring in Scotland, and crucially all of these sites that have started deploying through United for Health are planning to continue beyond the project. So we've achieved a degree of sustainability within those services, which I think is really, really important. But I think what's been our most significant achievement really has been the real sea change in terms of attitude and perceptions around telehealth at scale. And certainly that holds us in a really good position in terms of strategically developing this further in Scotland as we take forward what we've learned through United for Health into the Technology Enabled Care programme in Scotland. So I'll move on just really to tell you a little bit about what we in Scotland have seen as the key enablers for at scale. You'll see them presented here on the summary slides. I won't go into too much detail about them, but I think it's really important is this local ownership focus. It's about really being able to have integrated services that are localised and having really good engagement with clinicians on the ground. And you can really see that that's been a thread throughout United for Health, and that's really part of the achievements that we've taken forward. And of course we've had really fantastic, enthusiastic champions, we've had patients and staff, and it has really been about trying to share experiences and learning as we've been going along. In terms of some of the barriers, I think anyone will tell you an at-scale deployment project recruiting over 7,000 people in 3 years is a challenge. But I think when we look specifically at what some of those challenges have been, we think the very complexity of the size of programme in itself can be challenging, and it's really vital that everyone is engaged as an early point in the process. So e-health, our GP colleagues, all of the clinicians are really involved. And what's really been striking to us within the programme is the whole process of service redesign. It's time consuming, but it's a vital part. So therefore you really need to ensure that any project plan or any sort of preparation around deployment at scale needs to factor in these key and really important aspects within it as well. And one of the real challenges we experienced very early on in the project was around recruitment. We experienced lower patient numbers than we had perhaps anticipated. We had some challenges with clinical engagement, and we also found that the digital participation challenges in Scotland really are obvious, with some people not always having access to laptops and technology as we might have thought. So what have we learned? As well as recruiting and enabling more service users to use home health monitoring, the learning process has really been significant. So here on the slide you can see some main themes which really try and encapsulate what we've learned through United for Health. The first one is around technology. We have really learned that simple technologies are the best. They work as effectively, as efficiently as some of the high-end, expensive technologies. Our patients are more than happy to use their own devices to support some of this work. And in terms of releasing strategically economies of scale for Scotland, we really need to think more about a national procurement approach to technology. So they are just some of the key things. Secondly, it is about alignment. It's really important that before deploying at scale, that you have a clear understanding of your strategic, your national and your local priorities, and that they are closely aligned, and that everyone is committed to how this moves forward. And that takes time, and that's an important part of the process, because this is about long-term investment and change, and we really need to think beyond the project, beyond a small-scale pilot. What we've also learned a great deal about is the knowledge transfer process. It has to be done as an ongoing basis, not at the end of the cycle of the programme, throughout. And we need to build time. We need to allow staff to be released within that, to attend workshops, to be able to have this cycle of improvement built into the project as we go along. The other main area of learning is around stakeholder engagement. I think, as I mentioned earlier, there are a number of key stakeholders involved, each with different expectations, each with different objectives and goals. And it's a really important part of the process to ensure that communications plans and strategies really reflect that, and you work in terms of a programme approach to that and how you take that forward. And lastly, we have some real important learning about deployment planning at scale. It's very different from small scale projects. We knew that, we've now lived that, and so we have a lot of learning to bring to this, and we'll share that with our partners, and we'll share that nationally. So my final thoughts, I think that United for Health has been a real journey for Scotland. I see it as being a real sea changer for how we will deploy home health monitoring in Scotland going forward. It's been a fantastic opportunity to, I think, celebrate the diversity of healthcare services across Europe, and we're all learning. And I think to see that Scotland is really well respected in Europe in terms of the strategic positioning of telehealth and what we've achieved, I think that's been a really rewarding part of it. I think we're very pleased in Scotland with the progress we've made over the course of the project in terms of the achievements, and of course the collaboration. I call it Team Scotland. It's how we've taken this forward, and I think it has been in the true spirit of collaboration and joint working. And this is during a time when there's tremendous change within the health board areas, and I think that really needs to be recognised in terms of what we've achieved. And I think our real legacy will be with the programme is that we continue to build as we go forward nationally with this over the next 3 to 5 years. So we expect the final reports and for United for Health to be published early next year, and we'll be working to ensure that they're disseminated widely across Scotland. And currently we are working now in terms of taking forward our national home health monitoring strategy in Scotland, which again will build on United for Health.